I just want you to kind of brainstorm with me here. And this is again, this is making things super simple and somewhat vague. But if you wanted to break down initial treatment into categories almost to what can I give this guy? I'll start it off. Manual therapy, stretching. This is vague, and you can branch off of this. But activation. What other things could your mind go towards for?
So,
I mean, there's postural. There's
yeah, well,
from
I
an
guess it,
FRC type thing. It's getting to end range. That is somewhat. It's not necessarily stretching, but it's
yeah.
activation from an end range. And again, feel free to branch off to different points, but this is taking our what we do and making it into a reproducible process to where someone can say, I don't know, I don't know where to formulate or organize my thoughts when it comes to treatment. Like I've seen this different stuff and this different stuff. I have an intention, but I don't know how to get there. It's like, well, if you want to work stretching, you can go down this route. But I think that if you can make it like a flow chart almost a little bit to where this is your injury. What are your options? Manual therapy, there's stretching, there's activation, postural,
Yeah.
mobility, stability, whatever.
I'm looking to see if I might have wrote a quote down at some point, and so I think it really comes. I think things come down. I'm trying to find what it was, because it can be obviously it can be broad, like, and I don't think all these are unrelated. So, like, I think saying stretching, manual therapy, postural, like, I think all those are related, and I think you can break it down to almost like three buckets essentially. So what I have written here, it's not what I'm trying to say, but it's produce force, accept force, and produce force quickly. And
Okay,
so
good.
it's you have to be able to do all three to be healthy and perform as an athlete. But I think it also comes down to, you know, I didn't say a couple things. I would say range of motion, motor control, maybe not even range of motion, maybe just position. So I would say position, motor control, and capacity. And so I would classify a lot of those. Depends how you use the tool. And so, like, if you're using a postural, like a 990 hip lift, that could be a range of motion tool. Okay, so not range of motion. That could be a centration tool. Like, I'm trying to get a joint centered or get some change at a joint wise. But it could also be a motor control, which essentially is what it is. And so I guess it depends on which of the three do you deem this person needs. I mean, they need all three. They need position, most likely. In order to have position, you can produce force, and having a proper position allows you to accept force. Capacity not to break down, capacity to continually to produce force over and over again, depending on your sport, and that capacity is going to change per person, per sport, per position. Then you also need the motor control to now control those motions. And so I don't really stretch anybody. I stretch them if they ask for a stretch, but I think it's just eye wash anyway. And so when I hear stretch, I think of, okay, then so you need to elongate something. And so depends on your tool how you want to elongate it. So I do like a 90-90 or something where you can hold it for two plus minutes. I think that can give some benefits in the long run if you do it consistently. I guess it just you have to choose which tool do you want to use for which of those three. I guess it's a long one to answer to say. I think you can bundle all that stuff into one of those three buckets, essentially.